Being a pathway designated hospital means that having your nurses feel that they have a seat at the table, that they have a voice in their own nursing practice, in their well-being, in their professional development, patient safety, quality, things like that. That's what a pathway designated hospital is saying. Pathway gives out 2 awards. There's one for Nurse Leader of the Year and then one for Direct Care Nurse of the Year, and that's the award that I won. As the maternal-infant navigator, I provide support to pregnant patients throughout their pregnancy, whether that's connection to resources that are available to them in our community or social service resources, and then talk a lot about what kind of support they have at home. We started to notice a trend with a lot of our patients having food insecurities. Through COVID, we had already created an employee food pantry at our hospital, where if you were struggling as an employee of IU Health J, you could go into a food pantry and get a few items to get through the week maybe. But all that was supported by employees. We were providing the food for each other. And I had asked if I could start taking some of our pregnant patients there, because through those relationships that I had created, I started to realize a lot of our patients were short on food, for a few days a week or several days a month sometimes. Because of that awareness, that increased the size of our food pantry. Our CNO was able to get a grant from the IU Health Foundation. They provide money each month, and we have partnered with Second Harvest Food Bank to be able to purchase food. We've actually moved 3 different times, moved the food pantry to make it a larger size, yes. And we got a really nice appliance store that offered a deep freeze, and then we have 2 refrigerator freezers, so we're able to provide some cold items and frozen foods for patients as well. I really don't like the attention, to be honest. It's not something that I crave. I do my work for the patients, and I'm part of a team. I think that's really important to say. There are 5 of us on a team. We worked very hard to create this program, and I am very thankful to IU Health for introducing me to shared governance. That's actually what started my drive to be able to do more in shared governance, is just the ability for nurses to have a say in their practice, and I appreciate being encouraged to do that. It's actually entirely changed the trajectory of my career.